Daniel Gomez. I found out I was diabetic when I was 40 years old. And I think it's very important for me, and being Hispanic, to try to help not only myself and help the community, and try to figure out how you can improve your life and how you can make it better when you have a disease that is no cure for it. I really love the people. They made me feel very comfortable in an environment where there's a structure in a building that is filled with care and love. A lot of space, very comfortable, very warm. I always compare it to where is a house and where is a home. A house is just a structure. A home is the people that live in it with the stuff you put around it. And that's how I feel about the RCRC. It's like home. I'd love to be part of this program, and that's what I do the research, because I can learn a lot from them. And from the beginning of the process, it's a challenge, and they're with you the whole time, and they're always there for you. And so the transition through the whole process is really good. And with the people that you work with and the equipment that they have is very 21st century, and they help us to find something better for everyone. 13 years with diabetes, I went through the whole process of losing weight, trying pills, trying different things, the pen, and then finally got to the pump. And how important it is to know what's diabetes, and that it's better to find out that you have diabetes than not trying to keep it away from everything, because then if you know what to do and how to treat it. But if you don't want to accept that reality, it's going to be really hard to let go. Being part of the research and the study, you learn how to manage yourself better. Now in the clinic, you have the doctors, you have the nurses, and they spend a lot of time with you and responding to all the questions that you have. So it's not like a doctor's visit, you go and then you go home and trying to do your best. No, they're here with you and for you. One of my goals is that when I retire, I wanted to be part of an organization like this, to where I can bring up more awareness into the community. For me, the most important thing is that I want people aware of us chronic disease. That's what's important. To tell other people that are suffering the same, that it's okay. Your life is not over. You're just adding something, a routine into your life. That is another stress point that you need to learn how to live with it. And you can live with it. The clinic is very diverse and very inclusive. So that's very important. That's something I have to mention about this clinic. And that's why, as a Hispanic, I feel very welcome. Hispanics that they don't have either the financial, or they don't know how to deal with it, and they don't find resources. There's a lot of resources for everyone to get help. For me to be able to take this value that they're giving me and transmit it to my community is very important. And the more we transmit it, the more they feel comfortable into coming to the same process that I'm at, because they can get help.